And they are really, really violent. Sexual harassment. Can you clean me?
Okay.
And you cannot say no, right?
Let's go to the next question. So, 下一个问题呢，我想要问一下这个语言的问题。如果说在台湾啊，有人想要来德国做这个护理师，或是当护士，或是当这个医护人员啊，那他们是不是要会说德文？他们德文要说得多好，还是说他们只要会说英语就可以了？
So I think it's in every country the same because you have to understand the patients, you have to do the documentation. So I think it's like always you need to have B1, B2, or best it was like C1. Yeah, because I mean, if you don't feel comfortable, you cannot talk to the patients. And the patients, you know, in Germany, they complain all the time because that's the thing Germans can do the best.
Yeah, true.
And if patients are sick, I mean, I can understand they are in pain, right? And if you be like, I'm sorry, what did you say? They were like, oh, yeah, what are you going to hear? You don't even understand me.
Okay.
Or the doctor said, yeah, and I don't like do MRT or whatever, and you don't understand it.
Yeah.
It's not so good. So I would say probably, I don't know if they want the degree, but I think in the interview they were like, oh, how comfortable are you speaking German? Yeah, but I mean, currently we don't have enough nurses, so probably they always like hire someone, maybe, even though
there's only English.
Yeah. Because we have a lot of people from Poland or Romania right now who really cannot speak good German, which is totally fine, but not for.
Yeah, but I think if they ask people to have perfect German, I think it's really unfair because
No, it doesn't need to be perfect.
Yeah,
it doesn't need to be perfect. I'm just saying you need to understand.
Okay.
What people are saying. If you speak with accent, no one really cares. I mean, I wouldn't mind, but let's say I'm in really, really terrible pain and I'm saying, hey, my stomach hurts, and you don't understand me, like, you know, you can do nothing. And not everyone, that's the big thing here as well. Not everyone can speak English.
Yeah, true. In Germany, actually not.
Especially old people, so.
Yeah, true.
Yeah.
All right, wow, that's really difficult. I mean, German for me, it's a really tough language, and I think if you get that less salary, and then you also need to learn German, I think it's yeah. 那我们就接着进入到下一个问题呢，就是学历的问题啦。就是据我所知啊，德国应该还不完全承认台湾的学历吧？就是我想要知道的是说，他们如果想要在德国从事护理的工作，他们需要重新考证照吗？或是重新上这个不同的课程吗
？So Germany is really like all about documentation.
Yeah.
So they don't take exams from other countries.
Yeah.
Mostly you need a translation and to redo the exam, not the full 3 years, of course, but you have to do like a sort of exam.
Yeah.
I don't know how long it takes actually, but I just had a colleague from South Korea, and she just had to do the exam again.
Yeah.
And this language thing, and it took like 6 months or something.
6 months. Okay. I think 6 months is alright for training and getting know the full system. How does it work in Germany? The regular study for the nurses, how long does it take? 3 years.
And if you do like an extra exam, which I did for operation assistant, it took 1 more year.
Okay, so in totally 4 years if you wanna work as a operation assistant.
Yeah, of course, there's also an exam just for operation assistant, but I wanted to do the regular nurse and this on top because I had more options to do.
Okay, so you actually got 2 licenses. Okay. 好，那下一个问题呢，我想要问的就是说，为什么你离职了？就是说你做过诊所啊，你也做过医院，那最后你还是转行去科技业，就是原因是什么呢？压倒骆驼的最后一根稻草是什么？
So, a lot of reasons. First, money. The most important thing in life. Yeah, the money thing, because I mean, I told you I didn't really earn a lot, and during my time it was even less than now.
Yeah.
And I really struggled with paying rent and paying my bills, and I just suffered.
True.
That was one reason, and the second reason is just like because I was really tired and I got sick all the time. I mean, I worked even with a broken toe because I felt sorry for my colleagues. I didn't want to leave them like by themselves. So people go sick at work all the time, which also destroys your body. And yeah, like this is a part. And also I lost really a lot of empathy because dying and like being sick was a part of your job.
Yeah.
And I didn't want to be the nurse who's like, oh yeah, she died, whatever, you know?
Okay.
I wanted to be like I don't know how to say it, but a nurse who felt sorry for people and not just doing her job for money.
Okay.
Yeah, these were the main reasons. And why I went to IT is actually because I was like, yeah, I want a job where I earn a lot of money. It was rather IT or banking.
Yeah, sure. In Germany.
Yeah.
IT, yeah. Okay.
So I was like, yeah, I will just apply for both.
Okay.
I'm the one who accepts. Oh, and another reason, sorry, I forgot about that. What happened a lot, because we also had patients who were addicted to some drugs.
Drugs, okay, drug addicted, yeah.
And they are really, really violent.
Oh,
Yeah,
because
yeah,
they
yeah.
need to quit the...
Yeah, of course. I mean, if they are in hospital, they get medication, of course, and they get, of course, medication they need, but not as much to get high. And or we even like it's called Ausschleichen. They get less and less and less, and they get aggressive. They throw bottles, and also, oh yeah, there are another reasons. I'm sorry, I forgot all about these things. Sexual harassment.
Oh, wow.
Yeah, I don't know how it is in Taiwan. I mean, you can tell me, but in Germany, like being a nurse is a sexy thing. And
Oh, yeah, I think, yeah, this porno stuff always... At this uniform, right?
some men, I mean, in the uniforms don't look sexy at all. Like, really, we just
Okay.
have like blue or white and
Yeah,
oversized,
yeah.
but still in their brain is like they liked them. They like that you touched them to be like, oh, can you clean me?
Oh, okay.
And you cannot say no, right?
Because that's your job, yeah. Oh, that's bad. Yeah. I mean, yeah. Of course, there will be. I can imagine there's a lot of weird people, you know. Yeah.
That also destroys you, really. And I think people should have more respect for nurses because otherwise people quit. Right?
Yeah, of course. I think it's not only Germany, but also all over the world. People should give nurses more respect.
Yeah.
But can I ask why did you want to be a nurse?
It was my dream job and it still is.
Okay.
I love to help people and I love the job of nursing. And even though cleaning people is not my problem, but
Okay.
just the things around it. If we were more nurses for less patients, the money, the respect, and also that nurses get more days off. For example, let's say you did like 6 shifts in a row. You shouldn't do that. Just do your 5 days. And even retire earlier because you cannot keep doing the job.
Sure.
Like, I mean, I would say we need a law for nurses.
Yeah, it's so terrible. I couldn't imagine how this works when people are 50 and 60 and still work as a nurse, right?
So yeah, it was my dream job. And if the circumstances would be better, I would still keep doing it.
OK， 那我们就来到我们的最后一个问题啦，就是给台湾护理师的建议。现在说有一位台湾人正在镜头前呢，想要来德国做这个护理师或是这个医疗方面的工作的话，你会对他说些什么？你会给他什么建议？No, definitely not.
No, I mean, I have negative experience, of course. Maybe a happy nurse with a better hospital, for example, would say something else. But I would say it's not worth it. Like, do the new license, learn German, pay a lot of taxes.
Yeah.
And restaurants are super expensive here. You cannot go out to eat, so no. I'd rather go to the US maybe because nurses earn more.
Yeah.
But not in Germany.
No, not in Germany. Even after the night shift, there's no food for you. No night market, no 7-Eleven.
7-Eleven.
Yeah.
Oh yeah, just work at 7-Eleven.
To work at 7-Eleven, even better.
Free food, okay.
Free food, yeah. No, yeah, true.
Yeah.
Thanks for your sharing.
And thank you, 谢谢 to all nurses out there.
Yeah, all over the world, yeah.
Love to Taiwan.
Yeah, respect and love Taiwan for what? 小笼包.
Oh, cute ball.
Yeah.
And bubble tea. I have an idea for a new law in Taiwan. So nurses should get by government free bubble tea.
Free bubble tea, wow.
Free eating at Din Tai Fung like once a month. And like a night market gift card.
Oh, night market gift card. That will be. You want to get.
Then I'm also coming back as a nurse.
You want to go to Taiwan work as a nurse?
Yeah, it is. See, tell your president.
All right. Okay.
I'm like the new pink party.
Pink party, wow.
Vote for me.
We make a new party in Taiwan next year then.
I become president.
Yeah. Okay. All right, cool. Thanks for sharing and thanks for watching. 那我想我们这集就到这啦。如果呢，你还有更多的问题关于这个德国的医护环境啊，或是工作上面的问题啊，欢迎在底下留言，那我们可以为你解答，或是我们之后可以再出一集来为大家讲解，如果你们有更多问题的话。好啦，那这集到这哦，我们下期再见，拜拜。